Honestly, I feel like the food in the UC just keeps getting worse and worse.
It does.
I never find anything that I like. It's just so bad. I go hungry all the time.
Lori.
Are you okay?
No.
What's going
I
on?
don't feel good.
Oh, you should.
I'm having trouble breathing. My chest hurts.
Here, sit down.
My heart is beating so fast.
Help! What's going on, hon? I'm a nurse practitioner at Adelphi University. What's your name?
It's Shima.
Shima, what are you feeling?
My throat is getting tight.
Your throat's getting tight?
Yes.
Are you having trouble breathing?
Yes.
Can you open your mouth for me? Your tongue is starting to swell, and I see a rash going on. I think you might be having an anaphylactic reaction, okay? So we're gonna have you lay down. I'm gonna call my assistant nurse right away.
Okay.
Okay?
Yes.
Daryl, I need you to get over to Blodgett Hall right away. There's a patient here who might be having an anaphylactic shock.
Got it, Professor. Finally, something to do. What's going on, Professor?
Daryl, there you are. This patient is going into anaphylactic shock. What are we going to do for her?
I brought an EpiPen with me. I can give her the EpiPen.
Yes, that's great. And where are we going to be injecting this
Right
injection?
into her thigh. It's going to be right in the middle, intramuscular.
That's correct. Okay, so what's the first thing we're going to do?
Hand hygiene.
That's correct. We got to act quick. Okay, Daryl, whenever you're ready.
Okay. EpiPen. It's going to hurt a little,
Okay, we're going to
alright?
put an injection into your thigh, okay?
Okay.
This should start to relieve your respiratory distress, okay? Okay, we should take her vitals.
Okay, I'm going to take her blood pressure.
I'll take her pulse for now. Thank you.
I'm just going to get this on, alright? You got your arm?
Okay, pulse is 90 beats per minute, so it's going down. That's great.
Okay. And I'll take her blood pressure.
You're going to take slow, deep breaths for me, okay, to make yourself feel better.
Okay, her blood pressure was 120/80, which is
Okay.
within normal limits.
So her vital signs are stabilizing, which is a good sign. So that means that we have reversed some of the anaphylactic shock. Okay, so I'm going to take you back to my office with the assistance of my nurse over here. And
But before we do that, can we ask you a few more questions?
Okay.
Okay, do you know your name?
Shima.
Do you know where you are right now?
Adelphi University.
Okay. We just have to check her level of consciousness.
good call, Daryl.
Thank
And
you.
we're going to take you back to my office and see if you need any more treatment, like some oxygen or some fluids, okay?
Okay.
Do you feel like you're okay to get up with our assistance?
I may need a little help.
Okay, we're going to help you out in a couple minutes.
Okay. Thank you guys for saving me today.
Do you know what triggered your allergic reaction?
No, I don't know if I have any allergies.
Oh, wow. So then I'd like to refer you to an allergist so that you can figure out exactly what you're allergic to. I can give you a list of allergists on our way out.
Okay.
Okay? So now that you're leaving here today, you seem to be doing well. I'm going to tell you a little bit about the EpiPen, and I'm going to give you a prescription. You're going to purchase 3 EpiPens. You should always keep one at home, at work, and in your purse. Okay?
Okay.
Okay, so first of all, what is an EpiPen? An EpiPen is an injection containing epinephrine, a chemical that narrows blood vessels and opens airways in the lungs. So I'm going to write down instructions for you on how to use the EpiPen, and you can take this home and have it with you. And you should definitely keep these instructions in your purse in case you go into anaphylactic shock and someone needs to administer it for you. They can find these instructions with the EpiPen.
Okay.
Okay? So number 1, you're going to form a fist around the auto injector with the black tip pointing down. Then you're going to pull off the safety cap. Number 2, you're going to place the black tip against the fleshy portion of your outer thigh. That is called the intramuscular portion of your thigh. And if you're going to be injecting yourself or someone else, you should tap your pants to make sure your wallet isn't in the way, so that you're injecting your muscle instead of the wallet.
Okay.
Okay? And number 3, with a quick motion, you're going to push the auto injector firmly against your thigh. And finally, you're going to remove the auto injector from your thigh. And the reaction should reverse.
Okay.
Okay?
And that's in case of any more allergic reactions.
That's in case you go into anaphylactic shock again. But hopefully after you visit an allergist, you know what your allergies are and you should avoid those allergies from now on.
Okay.
Okay?
Yes.
Okay. Daryl, would you like to tell our patient a little bit about epinephrine?
Sure. So epinephrine works by bronchodilation. It's going to open up your blood vessels and it's going to help you maintain your heart rate and your blood pressure. It's also going to help you breathe by opening up the airways. You should be careful about the medication if you have a history of coronary artery disease, angina, any chest pain, diabetes, and you should also be careful if you're pregnant. One of the important things though is recognizing the symptoms of anaphylaxis or an allergic reaction. So you might notice some itching, hives, you might feel dizzy, nauseous, you might feel like vomiting, so symptoms like that. You should definitely seek medical attention.
Okay. And those are side effects?
Those are some of the symptoms of an allergic reaction.
Okay.
Yep.
Yeah, so those were some of the symptoms that you were having today,
Yeah.
right?
Yeah.
Yeah.
Chest pain, dizziness.
Mm-hmm.
So,
Okay. So I'd like to add to Daryl some side effects of the EpiPen, which is the epinephrine, is nervousness, tremors, restlessness, angina, which is chest pain, a dysrhythmia, which is an irregular heart rate, and hypertension, which is high blood pressure, also tachycardia, which is an increased heart rate. Okay?
okay.
Some other side effects can include nausea, vomiting, hyperglycemia, which is high glucose level, and also paradoxical bronchospasm. That is when the breathing gets worse, but that's only after an excessive use of the drug.
Okay.
Okay? So you should watch out for some drug-drug interactions, which means when you're taking this drug, watch out for using it with other adrenergic agents, because that can have an additive adrenergic side effect. Also, use with MAO inhibitors can lead to a hypertensive crisis, and also beta blockers may negate the therapeutic effect. Okay?
Okay.
So also be sure to know that tricycline antidepressants enhance pressor response to epinephrine.
Okay.
And finally, a drug natural product interaction is that use of this drug with caffeine containing products can increase the stimulant effect. Okay?
Yeah.
So all that should be also provided with you once you receive the EpiPen from your pharmacy.
Okay.
Okay? And here are the instructions that you can take home with you.
Okay, thank you.
Do you have any
Doctor.
questions or?
No, not really. You
Okay.
guys explained everything.
All right, great.
Okay. Nice to meet you, Rashima.
Thank
Have a good day.
You too.